But like the average age of a sudden fatal heart attack that knocks him out of the game, right? 50. One of my favorite podcasts, Dr. Ryan, is something called All In Podcast. It's a group of Silicon Valley entrepreneurs and venture capitalists and a billionaire or two. They did a really interesting breakdown a few weeks back. Brad Gerstner. What Gerstner was talking about was kind of something about cardiovascular health and CT scans. But what he kind of missed on was that nuance between calcified and non-calcified plaque, right? Not all plaques the same. Some plaques are stable, some are more dangerous. Some stats were kind of alarming though, right? Which is the first average heart attack in guys, men is 65, women is 72 years old. But like the average age of a sudden fatal heart attack that knocks them out of the game, right? 50 years old. That's why we're so concerned for entrepreneurs and business owners, guys that are kind of under the gun, right? They have no off button. But what's really challenging is the current CT scans aren't the best with diving deep in between calcified and non-calcified. What are your thoughts on?
Yeah, well, I mean, I think, first of all, I want to applaud Brad Gerstner for bringing it to the forefront. I mean, heart disease is the number one killer of adults here in the US. It's, the number one leading cause of death, followed by cancer and then apparently COVID-19. A lot of people they think of other things like, breast cancer, prostate cancer, but it's really heart attacks. That's for men and women. And secondly, I'm really happy that he brought the idea of these CT scans, which, as you mentioned, JD, as you alluded to, really refer to the calcified plaque. But he did miss at one point, because the reality is there is some controversy as to what plaque is the more concerning. What exactly is plaque? So plaque is really the composition in your arteries. It's really consistent of a couple of different compounds: cholesterol, lipids, calcium, and fibrin. And so soft plaque is a plaque that is primarily uncalcified. And that's the plaque that many cardiologists think is a lot more dangerous because it is more prone to break down and embolize and potentially cause a heart attack. And unfortunately, the calcium scans that are done, the CT angiograms where you get a calcium score, only assess for the calcified plaque. And for many cardiologists, they feel that calcified plaque is not as dangerous. It does decrease blood flow, but it's more stable. Right, it's more stable. It doesn't have a chance to embolize, to move, right, and cause a heart attack.
Right. So that's what was kind of interesting, though. Somebody that in that echelon, they were talking about Stanford Health and some brand name hospital systems, right?
Yeah.
They didn't have access or didn't know about the nuance between the two, right? That was really fascinating. And shout out to him. He's a fantastic public-private hedge fund investor, but this is probably not his power alley. But I guess going back to that concept there on soft plaque, right? We have kind of a new test that does a 3D visualization. Why does that matter, though?
The idea behind it, JD, is we have a 3D visualization of your coronary artery. So you can have a calcium score, but it's just like a score in aggregate of all the calcified plaques. But there could be certain areas or certain lumens of certain arteries that are far more calcified or have far more soft plaque than other areas, right? And as we kind of mentioned, the typical CT angiogram where you develop a calcium score only looks at the calcified plaque. You could have soft plaque. You could have it in several different arteries. Maybe it could be in your circumflex, your anterior descending, your right coronary artery. You're not certain where it is exactly. You just have a number, right? And then as we talked about, it really does not talk about the soft plaque, which is not really discernible on the typical CT angiogram. With some of the new scans out there, particularly the one through Clearly AI, you can actually establish that. The number doesn't necessarily, it gives you like the amount of calcium in aggregate. It doesn't necessarily give you certain areas that are stenosed. Like you could have a smaller calcium score, but if most of that calcium is concentrated in one artery and it's pretty stenosed and you're at high risk for a heart attack, well, that doesn't really help you.